I'm glad to note that many Kenyans are complying with the containment measures of hand washing, social and physical distancing, sanitization, self-quarantine, and even wearing of masks. I want to urge all of us to continue with this practice because it is the most effective way of combating this pandemic. I also want to appeal to the few who are not towing the line in this journey to quickly change their minds for the benefit of their loved ones and the country at large, because a chain is only as strong as its weakest link. Let us not be that weakest link in this chain. I want to reiterate on the importance of targeted testing. This activity, which is currently going on in Nairobi and Mombasa, is aimed at identifying those of us who may be having the virus in order to have them treated and also protect others from being infected. If we do not know where the virus is, it would be very difficult to fight it. We have said that this is an enemy that is unseen and that can appear anywhere, and we need to be prepared for it. If the targeted testing is precisely aimed at achieving this, for those who will be positive, together with their contacts, I want to remind and reassure the people of Kenya that the government shall meet the cost of treatment and quarantine. We are aware that this has been a source of concern for most people, and a concern that has led to weakening the fight against containing the virus. Because when people feel that they will be quarantined at their cost, they do not then cooperate and present themselves and their contacts for containment of the virus. So once more, there is no financial concern that those who turn out positive and require treatment and their contacts who will require quarantine have to fear about, because these costs will be met by the government. Our people should therefore not be afraid to come out for testing. And I also want to commend those that have presented themselves, and we have seen that more and more Kenyans are now coming out on their own to present themselves for testing. The more we do this, the more we understand the level of transmission of this virus within our communities, and the better equipped we are in targeting our interventions in those areas of highest risk. On targeted testing, we have noticed at the same time a disturbing trend of individuals who provide wrong contacts and telephone numbers during testing. Once the results are out, such individuals then become unavailable. This is serious, considering that some of them have tested positive and need to be contained together with their contacts. If we are unable to trace them, then we have weakened our effort at containment. I want to appeal to all our people to be responsible and provide accurate contact details during testing. The consequence of not doing so, particularly when one tests positive, can be disastrous.